Everyone. Thanks for joining us Thursday morning, Water and Health. This is the real hardcore group that's left in the building. My name is Ryan Kronk. I'm with the Water Institute. And this session is presented on behalf of the Washington Healthcare Facilities Community of Practice, of which UNC is the Secretariat. In this session, we will be talking about developing an action-oriented research and practice agenda for change to advance universal access to Washington healthcare facilities. I do want to say a special thanks to Lindsay, Denny, Naughton, Maggie Montgomery, and Arabella Hayter, who, of course, many of you know are the HCF Dream Team at WHO and UNICEF, who have really been driving the ship for quite some time now. They couldn't be here, but they've deployed proxies to speak on their behalf, and we're grateful that Anne and others have come. If you're not signed up for the Washington Healthcare Facilities Community of Practice, please do so. You can go to washingtonhcf.org. We've been a little bit out of sync lately because of scheduling reasons, but we aim to have a webinar approximately every month and a half, where we invite speakers to come in on different topics. We do have a session that Rick Johnson is going to lead, likely in November, on the new HCF, the global HCF update. We also had, if any of you were in Leanne Ong's talk yesterday, it was probably my favorite talk of Water and Health so far on water quality in hospitals. Very awesome stuff. It's first of its kind study looking at the intricacies of different water quality issues in hospitals in Bangladesh. We are doing a sneak preview of a massive systematic evidence map that is being led by one of our PhD students, Lucy Tanton, which you all get to see some of the preliminary findings this morning. And we have several other webinars in the works, including one on the, is it called the NWISE scales, is for Washington healthcare facilities. So Washington security in healthcare settings, healthcare waste management, ask an expert, and lots of other topics. So please join us. We have been also gearing up some working groups. So you can, if you're getting really excited, you can join those. Carrie is one of our faithful participants in those. So just a quick overview of our side event. I'll briefly talk about the methodological approach that we're seeking to deploy to develop this agenda. Then we'll hear from Lucy, who will present some initial findings from our ongoing evidence map. We'll invite up our panelists to kind of give some remarks on research priorities from their perspective and what they see as some of the big issues. We'll then do some small breakout groups to kind of come up with a list of potential questions. So we did run a similar session about 4 or 5 years ago, and we've also over the years developed research questions at various WHO working groups, and so we'll provide that initial set that you can work from, and also develop some new ones. We'll then report out and then have our panelists sort of reflect on sort of some of those findings and talk about next steps. So what's our approach to developing this agenda? We're hoping to use the Child Health Nutrition Research Initiative CHENRI method. This is the sort of high level summary of what this is. It's an exercise to prioritize research in research questions in a very transparent, consultative, comprehensive, and replicable manner within a specific domain. So there's actually been 3 recent examples of this. The first one is on WASH in emergency and humanitarian crises, led by Lauren DeMello-Guyette, who's here. So they just published this earlier this year through this consultative process. There was actually this middle one on a research for sanitation workers. They actually used a workshop at the Water and Health Conference several years ago to sort of compile a list of questions. So that one was done. And then there's a third one that I'm less familiar with, but you probably recognize some of the names on it, on menstrual health across the life course. Bethany Caruso and Julie Hennigan, Marnie Sommer were on that. So some familiar names. And so this is sort of this method's been applied across various global health fields. So I'm hoping that this will help us galvanize action and sort of have a framework to compile questions in this space, which of course is very complex. There's more than just WASH. We've got environmental health and IPC and lots of other stakeholders involved. So some of the key elements to compile topics for this agenda are a scoping review of the topic, which Lucy will be presenting on some preliminary findings, informant interviews with key stakeholders, which we will do down the road, and then focus group discussions, which we're using this water and health session to generate a preliminary list of questions. Other steps that will be involved in this, and this is a very high-level overview of this method, we'll have process managers that will help guide the agenda. So a core team that will work with Maggie and Lindsay and others to kind of help steer the process. We will develop a set of question review criteria. So what are the most important elements of a question? We will also do some specification and scoping on defining the context, which may include publishing multiple agendas. I actually ran into Lauren, who did the WASH and humanitarian settings agenda, and I asked her, how was it doing all of WASH and humanitarian settings? And she said, very challenging. You might want to consider breaking it up into more discrete agendas. And actually, if any of you know Georgia Gahn, who's at London School of Tropical Medicine and Hygiene, she just published a research agenda on cleaners in healthcare facilities. So we would love your feedback on different ways we can break this up into more manageable pieces. The one key thing that she mentioned, which I thought was a really helpful insight, is that when you combine everything in once, you kind of lose some of the nuance. So she said systems approaches were not quite captured because you get into the intricacies of water treatment and various topics. So we would love your feedback on how we can kind of break it up into more manageable bits. We'll then compile a master list of questions and consolidate sort of similar ones, and then there will be a scoring and ranking exercise through surveys and likely another online consultation through the community of practice. So with that, I will turn it over to Lucy to give us an update from the evidence map.
Great. Thanks, Ryan. And hi, everyone. So as Ryan mentioned, we've been working on a project to put together an evidence map on WASH in healthcare facilities in low and middle income settings. So today, to kind of help frame our discussion and identify some research priorities, I'll present a few of the preliminary findings from the evidence map. So just as some background, as I'm sure we all know in this room, safe and quality healthcare requires access to a set of essential WASH services. And these typically include your typical water, sanitation, and hygiene, as well as waste management, cleaning, and sometimes energy is kind of included in this package as well. However, many healthcare facilities, especially in low and middle income settings, lack these basic WASH services. So worldwide, in the most recent JMP update, close to 80% of healthcare facilities had basic water services, 57% had basic hygiene services. However, service levels were lower in low and middle income countries, as well as fragile contexts and rural regions. So this figure is from the fragile context, showing that while over half had basic water services, service levels or basic services were in less than half of facilities for the other WASH domains. So there's certainly room for improvement, and our question is, how do we move forward here? And recent publications by the World Health Organization and UNICEF have indicated that while there has been progress toward achieving global targets for access to WASH, including universal access by 2030, we are off track for achieving these targets. So then the question becomes, how do we accelerate and sustain access to WASH in healthcare facilities and meet some of these benchmarks? One framework that's been proposed for improving WASH in healthcare facilities is this 8 practical steps framework. So this framework involves policy and practice steps to improve WASH, from conducting a baseline assessment of conditions, setting targets, creating costed roadmaps, establishing standards, going out and making improvements, monitoring and reviewing data, developing the help workforce, engaging communities, and finally conducting operational research. And this can kind of be seen as like a continuum of steps from the initial policy and guideline formation, implementing programs, to having long-term sustainability. I don't think these steps are necessarily meant to be sequential quite like this, but it can be kind of a framework we can think of for improvement. And we feel that at each of the steps on the 8 practical steps, research can inform and accelerate progress. So with that, we sought to create an evidence map to understand where we stand on WASH in healthcare facilities and identify areas for improvement. So our objectives were to build a shared understanding and consensus around topics related to WASH in healthcare facilities in low and middle income countries, identify areas in need of further assessment or policy and program development, and set priorities for moving forward in the future. So our study design, this was a systematic literature review. So we conducted literature searches using terms for WASH, terms for healthcare facilities, and terms for low and middle income countries. And I'm not really going to go in depth on the methods here, but I'm happy to answer any questions that anyone might have about that. And then we performed a title abstract screening process. And through that, we identified about 4,200 studies that met our criteria. So these are all the studies published in English since 2008 that focus on WASH and healthcare facilities in LMICs. We're now working on this evidence map and literature inventory process. So we're looking at studies just at the abstract level and doing kind of a very broad, high level literature inventory tagging process to classify them based on their topic, their method, and their relevance to the 8 practical steps framework. We then plan to do some additional work with this body of literature, including by conducting further systematic reviews on more targeted topics that will involve full text screening and data extraction to really dive into a few of the key topics in this field. So currently we're working on this evidence map literature inventory building process. We are about halfway through tagging our studies. So today I'll present results from about 2,000 of the studies that we've looked at so far. And it's kind of like a random subset of the overall studies. So hopefully can provide some insight into the eventual trends that we'll observe. So I'll present a few of the key findings here. So first of all, just a breakdown of the WASH services that facilities examined. So as you can see, sorry, the text is a little bit small, but the really big bar is for studies that are looking at hygiene at the point of care. So we differentiated between hygiene that was occurring in clinical settings, so hand hygiene and PPE usage by healthcare workers in direct clinical interactions, versus outside the point of care. So that would include hygiene among patients, families, and workers outside of clinical settings in healthcare facilities. So as you can see, a large portion of the studies that we've identified have focused on hygiene in clinical settings. There's also several studies on waste, and then very few looking at water, sanitation, hygiene in non-clinical situations, and cleaning. We also did a breakdown of research methods. So the top bar, which kind of has the darkest cells in the heat map, is for cross-sectional studies. So quantitatively examining conditions at one point in time. And as you can see, there are fewer studies that look longitudinally at conditions across multiple time points, use qualitative methods. And then down here, we kind of have non-experimental or experimental interventions. So there's relatively few interventions compared to the baseline cross-sectional studies, and of those, most of them use non-experimental or quasi-experimental methods. We also looked at how studies mapped onto a framework that we kind of based on the 8 practical steps. So kind of looking at which of these steps that study might be able to kind of inform or provide guidance for. And we found that most studies corresponded to this kind of baseline assessment step. So just trying to really understand what the existing conditions were, identify problems and room for improvement, but not necessarily making those improvements. We also added a step 1C, which doesn't exist in the original framework, for formative research. So that was looking for studies that draw associations with WASH with other drivers or impact. So kind of getting a little bit beyond just baseline assessment and actually looking at maybe some determinants of conditions. And as you can see, those numbers are a little bit lower than just like the pure baseline assessments. Step 2 and 3 relate to kind of the policy process of setting guidelines and standards. And we found very few studies that examine or report on actions related to this process. And then step 4 is improving conditions. That's where our kind of intervention studies fell. So as you can see, there's some differences between environmental topics where there's a lot of interventions around hygiene and waste, but very few that relate to water, cleaning, sanitation. And then not lastly, I have a few more slides, sorry, but we looked at geographic trends as well. And as you can see, there's a lot of studies coming out of India. That was the largest number, as well as other Asian countries such as Pakistan and China. And then, I mean, part of this is proportional to population, but we do see kind of some trends and gaps, especially like on the African continent, where while there's a lot of studies out of Nigeria and Ethiopia, there's very few from Central Africa or the Sahel region, even if these are kind of priority areas for a lot of the WASH work that we're doing. We also looked at time trends, so the year the study was published. And as you can see, there's been kind of a gradual increase over time since 2008 as this field has been growing. And then in 2020, there was a giant jump, largely, we believe, due to the COVID pandemic. So this was driven mostly by studies looking at hygiene conditions, hand hygiene and PPE availability, for example, during COVID. We ran our search about halfway through 2023, so that bar is a little lower for that reason. We plan to do a search update this winter, so it'll be interesting to kind of see if that trend holds. As COVID research might be dying down, what will be happening to the overall trend. And then lastly, we kind of looked at some priority topics or populations and tried to look at the number of studies that examine these settings. So we found that about 8% of studies looked at WASH in maternal and child health settings. About 28% were conducted during the COVID pandemic or kind of made direct reference to COVID conditions. So again, kind of explaining a bit of that time trend that we saw. While about 4% were conducted in the context of other epidemics, such as Ebola. And then only about 1% of studies, or about 13 of the ones that we've looked at so far, examine WASH in healthcare facilities as it relates to climate resilience or extreme weather. So definitely some topics that are kind of priorities at this conference or in the WASH field that have not been studied very often in healthcare facilities. So then I'll just kind of introduce another step in this process, which is doing a closer look at the impacts of WASH in healthcare facilities and how these impact health and well-being of patients and healthcare workers. So we're interested in examining evidence for impacts of WASH, including kind of a range of impacts on health and well-being. So getting beyond just looking at impacts on healthcare-associated infection and trying to understand what is the evidence for impacts of WASH on things like healthcare worker stress, patient satisfaction, health-seeking behavior. And there have been prior systematic reviews that have examined evidence for impact of WASH in healthcare facilities. Most of these have focused on a narrower range of impact types or study designs, and therefore have included only a small number of studies. So here's a few of the prior work that's been done. There have been systematic reviews of impacts of WASH on infections, as well as care seeking and patient satisfaction. And these have really played an important role in helping us understand some of the potential impacts that may arise from safe WASH in healthcare facilities. But again, they've had kind of a narrow scope. So we're really hoping to build on this research and look more broadly at these types of impacts. So we've kind of created this framework that we're hoping by the end of the systematic review, we'll have it filled in to look at different types of impacts. So we kind of are differentiating health impacts and non-health impacts, and then within health, looking at physical, mental, and social impacts. And then for non-health, looking at time and economic impact. So kind of just some preliminary trends that we've seen as we've been preparing for this systematic review is that there are very few experimental or quasi-experimental studies that are measuring these health and non-health impacts of WASH in healthcare facilities, but there are quite a few kind of cross-sectional studies or qualitative studies that do suggest that these associations exist. So this evidence might not be considered very high quality, but it does provide insight into potential trends. There's a lot of, oh, sorry, I meant to show that to you here. We have found that there's not a lot of evidence around healthcare-associated infections or occupational injuries, just given the difficulty of measuring this in healthcare facilities. So we're interested in thinking about how to be able to pick up on these health impacts in ways that can be achieved in a low-resource setting. We've also seen a good amount of qualitative evidence around things like patient satisfaction and quality of care, a lot of it coming from the maternal health field. So definitely something that would be interesting to explore further and think about kind of quantitative indicators that could be developed for some of these trends that have been observed qualitatively. And then finally, in community settings, there has been research into the time and economic impacts of WASH conditions, but this is rarely examined in healthcare facility settings. So another area that could be kind of interesting to think about developing indicators there. So that was just kind of a brief overview, but in conclusion, just to sum up what I've talked about so far, we found that while there has been a lot of work to assess the baseline conditions of WASH in healthcare facilities and understand the current problems that exist, there are fewer studies that identify drivers of change or actually test interventions. And there are several priorities in the WASH sector, such as water quality, sanitation, and climate, that are relatively understudied in healthcare facilities. As I just described, there are a lot of studies that identify plausible impacts of WASH in healthcare facilities on healthcare worker and patient well-being, which really provides an opportunity to develop more quantitative indicators and integrate impact measurement into future research. We also saw kind of a lack of studies around the policy, financing, budgeting process. So this is really an area for opportunities to develop more evidence as well. And then finally, the importance of intersectoral collaboration. So our evidence map, we sought to kind of look really broadly with our search terms, and in doing so, picked up a lot of studies outside of the WASH field. So things like maternal child health, more kind of clinical IPC, kind of management types of studies. So it really showed that a lot of people are working on this topic, but using different terminology, looking at it from different angles, and great to think about how we can kind of work together and harmonize the way that we're working on this. Great, thank you. Thanks for listening, and I'm happy to take any questions.
So our folks online can hear.
And also, I have a poster that I presented on Monday, and I brought it here. So if anyone wants to look back at any of like the figures that I quickly showed up there, you're welcome to take a look.
I'll just contextualize a little bit more as well. So our search purposely was designed to be very broad. We actually used, Lucy had the three other reviews. Many of you might be familiar with Ollie Cummings' review on the HAIs. We actually took a lot of their searches so that we could, and had a very inclusive, broadly, sorry, what's the word I'm looking for? It was very inclusive. We wanted to capture as much evidence as possible, even all the way down to sort of qualitative formative studies. So that's why this evidence map has ended up so huge. So if you're not familiar with the systematic review processes that are often done by US federal agencies like the EPA or NIH, typically you'll start out when you're looking at a new research area, you'll start off with an evidence map. This very high level systematic mapping. You use tools like Tableau to really look at all the evidence. From there, you'll drill down into what's called a scoping review. So you have a more targeted research question and drill down to kind of look at sort of the studies in a specific domain, like water quality. And then you might drill down further into more of a systematic review and meta-analysis on a very, very narrowly defined topic. And so Lucy's review that she's presented on sort of these benefits, the health and non-health benefits, that's going to be a systematic review spinoff. There's also going to be lots of opportunities to deep dive into this data set further on more specific topics. We are planning a scoping review on water interventions and one on sanitation interventions, since those are very rarely studied. Others we're probably not, we're going to de-emphasize a little bit, like cleaning, because there have been reviews. There are some other waste management reviews. So we're trying to really zoom in on sort of these understudied topics to really unpack what we know and what we don't know. And just to reiterate what Lucy said, the advantage of having this broad scope is that we've picked up a ton of evidence that the WASH sector's not been looking at. There's a lot of physicians and other people in the health sector who are doing really excellent work that we're not really paying attention to. And even if they're on topics that are adjacent to what we're doing, a lot of the ways they're approaching the problems, we can adapt to the WASH sector. So that's one of the hidden insights that we've started to discover, is these studies that we've not been regularly looking at that we're really looking forward to unpacking. So thanks for letting me jump
thank
in.
you. I appreciate that.
Any questions though? Yes. Let me grab the mic.
Thank you very much. And first of all, congratulations for doing such a fantastic work. I think, accumulating the evidence synthesis from into the sector is quite vital, especially healthcare facility. While we are talking about hospital-acquired infections, and AMR is where the center for our discussions. And this kind of analysis will actually give the insights. I'm just wondering, because the majority of your the publications, especially on hygiene behavior change, are very recent. And you mentioned that there are not many intervention studies, and that might potentially necessarily because you have many observational study that might give you very skewed view, not literally attributing, not only establishing the association. So what are you thinking? Are you also prospectively thinking of doing the similar systematic search in a couple of years down the line, so that at least the things that are being said will actually have been completed, and the health outcome especially will have demonstrated more evidence synthesis into this?
Yeah, thank you so much. And that's a great question. And I think our field is like rapidly advancing. So there might have been a lot of studies just in the past year or two that are really implementing interventions and doing this more advanced work that we didn't pick up. So we do plan to do a literature search update at the end of this year. So we'll capture studies that came out in the past year. And I think at that point, we're hoping to at least be able to kind of like publish what we have so far and get that out there. I think it would be great to make this kind of like a living systematic review or evidence map where we can have updates every so often to look at the literature that's come out in the past few years. So that's definitely a goal that we would love to try and achieve.
Thanks. I actually wanted to pick up on what you said, Ryan, about the finding new studies that maybe we were not aware of or using. And I'm just curious how you did that. And I mean, it strikes me that, yeah, like the way that we talk about WASH is maybe not reflecting what is actually happening in many cases related to water sanitation hygiene. And that even extracting some of that terminology and approaches could help us to better communicate with health sector and be on the same page. It's like, so that in itself, I think, like you said, could be a useful output of this work, just to get us on the same page about the terminology. I'm suspecting that's what you came across, but.
Yeah, definitely. And as Ryan said, we really went very broad with the search terms that we use to try and find studies that, maybe they didn't mention hygiene, but they talked about infection prevention and control. And then nested within that was, hygiene or cleaning. So trying to not only use like the terminology that we use in WASH, but include kind of some like maternal health search terms as well as IPC. And then also in kind of our screening process, we included studies where maybe their primary objective wasn't to measure WASH, but they ended up doing that. So like there were a lot of studies that from the maternal health field, their stated objective was to measure maternal satisfaction, but then they looked at, how cleanliness of toilets influenced satisfaction. So we didn't just focus on studies that had like a primary objective around WASH, but tried to go more broadly. And yeah, I think we did find a lot of interesting things from other fields as a result. Does that answer that? Yeah.
Hi, the scale of this is quite scary, but congratulations on it. Usually for systematic reviews, it's often accompanied with quality appraisals. So I was just wondering, did you have to do a quality appraisal for this and for like such a huge number of studies, and what was your method? Yeah, thanks.
Yeah, thank you. And yeah, quality appraisal is definitely a part of most systematic reviews. In this case, we have not done one, and I don't think we plan to do one at this evidence map literature inventory level, simply because we're looking at such a large amount of studies and also such a variety of study designs that there wouldn't really be like a great way to have a unified quality appraisal metric to the best of my knowledge. That said, I think, as Ryan mentioned, we do plan to do more traditional systematic reviews on specific topics, and those will involve full text data extraction and likely some quality appraisal as well.
Yeah, there are academics who all they do is systematic review methods. And at the evidence map phase, you don't do quality appraisal, and you usually don't even do data extraction. You do what's called more of a literature inventory, which is what Lucy's done this. She said tagging, it's this very basic inventory, but the quality appraisal step happens at that systematic, once you get down to a systematic review on a narrowly defined topic. So yeah, sorry, very in the weeds, very nerdy science stuff that I get excited about. Any other questions? Yes.
So I just wanted to say that was fantastic. I thought that was really a fantastic piece of work you've done in surveying all the studies. I was just curious, how do we Like, is there a way of knowing how we are overlapping with the health sector research agenda, with our WASH sector agenda, like a way of mapping, the provenance of these studies? So if they came from the health sector, where do we intersect, and how can we start moving in a direction where we could sort of get WASH on the health sector agenda?
Yeah, that's a great question. And I mean, we're not like looking explicitly at, the origin of the studies or the authors or anything. But I think it would be really interesting to look at a few of kind of like the methods and topic trends that we've identified and see like how closely those might relate to what's being picked up on in the health sector. Like, are they also seeing a lot of these cross-sectional studies, or if the trends are similar? And if they have been seeing more interventions or RCTs than we're seeing, maybe looking at why that could be and what are the topics that they've been able to kind of advance on.
I was just wondering, how can we access this data later? Like, for example, I'm only interested in India and the trends in India. So how are you planning to make it available for later?
Yeah, thank you. And glad you're interested. So as I said, we're still working on this literature inventory process. We hope to have it completed sometime early next year. We'll see how big our literature search update is, but we will publish the findings, and we also will have these visualizations online in kind of an interactive form. So like those heat maps, the idea is you could like click on the cell and see the studies that fall within that. Same for like countries and whatnot. So hopefully sometime next year, we can get back to you with the publication.
Any other questions?
Yeah. Yeah,
How many student hours?
a lot. Yeah. Yeah. So we do have a great team of undergrads who've been working on this. And I realize I should have included an acknowledgement slide here. We ran our literature search just over a year ago, I believe. And then screening the studies took maybe 6 months. And then we've been working on this tagging with a bit of a break over the summer, given the undergrads' other commitments. So we've had a team working on this for about a year. We did, yeah, and I didn't really go in depth on this, but we ran our literature search with the help of the health science librarians at UNC, and the search turned up about 28,000 studies, which was a little overwhelming. But then, they did a machine learning process that basically we screened like a seed set of about 1,000 studies, like whether they were included or excluded. They fed that seed set back into a machine learning algorithm, and it kind of used that to prioritize studies that were more likely to be included. And it prioritized about 10,000 studies for manual screening, plus we added a few more as kind of an insurance step. So that drastically cut down on the amount of manual screening we had to do. Great, thanks for asking.
Harrison from Ghana. I just wanted to touch on the action-oriented aspect of the research that you're doing, because I see you are doing some work with the Ghana Health Service as well.
With Ghana Health Service. So this systematic review is kind of like global. So we're looking across all countries, including Ghana. We have other collaborations in the Water Institute with Ghana Health Service that, I think as of now don't relate directly to this, but I'm not sure, Ryan, if you had any other.
Any other questions? Oh, yeah, go ahead.
The question is, if you could touch on the action-oriented aspect of your research, because you start with action-oriented research. So if you can touch on that, how action-oriented it is.
Yeah, of course. Yeah, so I think the way we tried to set up this evidence map was really to have practical relevance. That's why we kind of incorporated this 8 practical steps framework that we're looking at how studies relate to different policy and practice steps. So I think the idea is we can kind of look at this evidence map to identify where do we need more research, where do we not have enough evidence to form a policy or guideline, and where is there enough research that we should be starting to actually set some guidelines or be able to make a consensus about what the next action is. So I think that's where the practice part comes in, is helping us to understand kind of where do we need researchers in the room, where have researchers done their job, and now we kind of need the policymakers. And then also hopefully our kind of deep dives into different intervention strategies around water and sanitation can also be useful for people working on WASH programs who want to understand what interventions have been done, what works, where can they innovate.
The benefit of the evidence map is that it enables us to work with partners and generate evidence more rapidly. So for example, if you're an organization that works in 5 countries in South Asia on menstrual hygiene, and you come to us and you say, I want a synthesis of the interventions for menstrual hygiene in these 5 countries in South Asia from the past 3 years, you can click 4 filters and then immediately pull all of those studies and then be able to very rapidly synthesize what interventions are available on that topic in that area. And it cuts down the time to process that information from months to days.
Great, thank you. All right, Ryan, I can turn it back over to you.
All right, thanks, Lucy. So I think we'll invite up our panelists now. We have Dr. Mary Ashinayo is unfortunately not here with us. She, as you know, has been on almost every panel inside of it, and I think she mixed up her dates this morning, so she won't be joining us. Also invite up Claire Chase from the World Bank, Jesse Shapiro from USAID, and Ann Thomas from UNICEF, who will also be delivering some remarks from WHO, who were double booked at this time. And so the question that I have for each of you is, and then we can open up the floor to some questions from the audience, is what are the high level research priorities in Washington healthcare facilities from the perspectives of your organizations? Maybe we can start with Jesse. Okay.
Oh, I get to go first. Yay. Well, then I have a really long list. Yeah, thanks, Ryan. And so I'd start with, I think there's still some obvious gaps that we need to fill around just the impacts of Washington healthcare facilities, both in health, but also which was mentioned partially in the presentation, these other benefits, because I think they in particular could be very useful in motivating health systems and actors to take action. So these are things like, how does WASH affect staff retention, patient confidence, number of visits, revenue for the facility, for instance. And then the broader agenda around how does WASH affect resilience? I think there's the second area, I think, is we really need to understand the models for managing the services. So for instance, we're funding one study now looking at the different operation and maintenance models for WASH services in healthcare facilities. But it's just not about the facilities themselves. It's also about the systems and the way you manage and operate them over time. So looking at how do we integrate WASH into the monitoring systems? How do we extend the essential supply chain management issues, for instance, for small items and equipment like soap. I don't know if you know this, but that's not on the essential list for most health systems. How is that possible? Well, it exists. So how do we integrate that in? We currently funded a development of that list, and we're trying to scale it up, and we need to understand how better to do that. And then into the monitoring systems, which I mentioned. I think another area that could use some more research is just in understanding how to be more effective and efficient with the resources that the health system has. There's a lot of new inventions out there. AI was mentioned today. This could potentially create a lot of new efficiencies in the system. There's various ways to use it. We're gonna USA recently funded a study on use of AI to like monitor hand washing. It was a failure. So we can learn also what not to do. But there probably are a bunch of useful uses of that in the system, and I think that's another area for study. And then there's been some talk at the conference about sort of like decentralized production of some of the consumables for healthcare facilities. So this can be like soap and alcohol-based hand rub. And then we have the device out in the lobby with chlorine creation as well. I think during the pandemic, we studied a bit in an emergency situation. Oh, well, we don't have any alcohol-based hand rub or soap available. Like, how do we quickly create this and produce this at sites? But at every health facility, that probably doesn't make sense. But the supply chains are getting interrupted routinely. And so can we do that in some decentralized manner? And then the last thing I'll say is that I think one of the tricky things we encounter a lot with WASH is like who manages the WASH in the facility. And in a lot of health systems, the person put in charge is actually like a doctor, right? They're not a professional administrator. And I think coming to grips with sort of that main staffing challenge is something we need to look into a bit more. And it's not just for WASH, it's for many of the other issues at health facilities, but what can we do about that? What are the models to address those infrastructure? That could include capacity building, but also maybe change in staffing patterns or other systems. So that's a bit of a long laundry list, but some of the thoughts at USAID's mind at the moment. Thanks.
Anne.
Yeah. So thanks, everyone. And I'm wearing two hats today because WHO, well, has another session right now, but also because we lead this joint task force on WASH, waste, and electricity in healthcare facilities. So I'm representing the dream team, which is Lindsay and Arabella and Maggie, which have been, who've been the engine behind a lot of this work. But basically, it's two streams of research that we are sort of pushing for. One is around the sort of making the case type of research. And then the other is around implementation approaches. So a lot of our work is around, sort of applying WASH fit and supporting governments to do the 8 steps that Lucy talked about. So under making the case, we have things like looking at, the impacts on quality of care, particularly around delivery and newborn care. We also are looking a lot at costing studies, cost benefit analysis, including the cost of inaction and economic savings from investing in WASH and healthcare facilities. But we've also just started a nice piece of research with USAID on non-health benefits. So looking at things like the impact on WASH on staff satisfaction, care-seeking behaviors, facility revenue, things like that could really help drive bigger investments from governments in WASH and healthcare facilities, because we are seeing anecdotal evidence from countries like DRC, where we're seeing that what do we have? We had a WASH package in healthcare facilities supported higher vaccination rates, or that revenue to facilities, doubled after investments in WASH. So we want to sort of compile those kind of pieces and make a more compelling case on why we need to invest. But then on the implementation side, we have been implementing WASH Fit for a long time now. I think we're really keen to look at whether the implementation and application of WASH Fit can move from being sort of a one-off assessment to a more integrated support to improved programming in healthcare facilities, and also the addition of things like climate resilience. How is that being mainstreamed through the application of WASH Fit? We're also pushing now for WASH, waste, and electricity to move in line with each other. So, we don't have investment in refrigeration at a healthcare facility without thinking about how solarization can impact on the broader infrastructure in a facility, models for operations and maintenance, and then optimal waste treatment technologies. So I think these are some of the areas, but then I was just asked to just say a word on, the fact that we really do want to embed some of these research priorities into the health agenda, looking at AMR or IPC agendas where WASH played a huge role during COVID. How do we continue to work with our health colleagues to get WASH higher up on the health sector's research agenda? So I think I'll stop there.
Thank you, Ryan. I think we need the researchers to get the donors and partners on board with what's going on in all of our institutions, because Jesse mentioned the work on management models. We are also doing work on management models. But that really is an important one for us, is understanding the operations and maintenance mechanisms for longer term sustainability. So we're working with the Water Institute right now on a review of management models and what is being done across different, what's in the published literature, and then also what are different partners and agencies doing to manage the services once they're in place. And then eventually the next phase of that would be more of like a implementation research. So implementing these management models and understanding how well they're functioning. So yes, let's connect. And I think WaterAid is also doing something. So, but I mean, it's just to, I think, demonstrates that this is a really key area where we feel there's perhaps an evidence gap, but probably more of an implementation gap and sort of scale of what is actually working. So I'm glad to see that there's a lot going on there. I think within the management models, one specific area that we're very interested in is around results-based financing. And we see that as a key opportunity because, at least in the World Bank, many of the programs in the health sector that we support are using results-based financing approaches or pay for performance. So, and to some extent, they're already looking at, whether there's functional water supply or whether there's the caregivers are washing their hands, but how can we make that more evident in the outcome-based approaches of those programs? And then I think along the same lines, trying to understand different contracting mechanisms, and that can get into private operators or private engagement for designing, building, and operating the systems where the government would then be just paying for the service. So there are a range of models that are used in the water sector that we haven't really looked at applying that in healthcare facilities. So I think we're very interested in understanding some of those opportunities. I think also definitely on the vulnerability, just to understand where, well, does access to WASH mediate climate or other shocks? It could be the health shocks, right? The pandemic or conflict shocks. And where do we see those vulnerabilities in healthcare facilities across different settings because of the water limitations? It's interesting. Your evidence review showed the really limited evidence specifically for water supply and sanitation. And I do feel that we're often coming to the health sector about WASH in healthcare facilities with really the evidence behind us really through the hygiene pathway. So I do think that more evidence is needed, and that should really be a priority, looking at the specific pathways for water supply and sanitation. And the reason that I think we do have this, we're looking at how to do a WASH and energy package, but at the end of the day, much of our financing is going through ministries of water, which are really only going to be looking at water supply. So for us to make the case for investment through that pathway, we need to have the evidence for specifically for water supply and also sanitation. I mean, what are the health impacts that we're expecting from sanitation in a healthcare setting, as opposed to what we would typically think about in the community setting? So I think those are all important. Oh, and there was also, I was discussing with some of the researchers here, work on intermittency and water supply. So as we get more sophisticated in our research on Washington healthcare facilities, some of these questions that are the community is addressing for broader water supply, I think will become much more important to understand Washington healthcare facilities. And lastly, let me just say that so the bank is one of the largest financiers, external financiers of Washington healthcare facilities. And we, through our new global challenge programs on water security, climate adaptation, and health emergency prevention, preparedness, and response, Washington healthcare facilities is a key intervention that will be scaled up under those programs. And I just want to offer that opportunity for researchers to use that for some of this experimental, quasi-experimental evidence that we should be generating. Thank you.
Yeah, if I can try to pull together some threads, I think one thread I'm seeing, and I think Dr. Mary would also agree, is that it seems like we're learning lessons from sort of the community WASH space and the research that's been done, WASH benefits shine, which showed very little health impact. And what I heard a lot of, I didn't really hear a whole lot on health impact, more on management models, sustainability, understanding, making the business case to other sectors, which is really great to hear that, we're not, I still think the health evidence is very important, but not maybe an emphasis. And I think I was in the session yesterday with our colleagues from Tanzania, many of whom are in the room, and they showed a video. And I do think it's a very visceral reaction when you hear stories of women delivering. There's no water, there's no toilets, there's staff are overcrowded. We saw Leanne's presentation yesterday, just the absolute overcrowding in some of these hospitals. We just know that these are absolutely essential things. We do not need a large-scale health trial to prove and demonstrate the need. So I really am glad to hear a lot of these suggestions and focal points for research. And obviously Lucy presented on these non-health alternative benefits, I think are a really important way, at least from a researcher's perspective. Many of these are much easier to capture and can be quantified, so we can show the full suite of benefits. We've talked with partners that are go into communities and they do community WASH and WASH in schools and WASH in healthcare facilities, and you can go into a community and see that there's transformation, but when you're only trying to measure a narrowly defined health impact, you're not seeing the pop that's actually happening. And so looking at a suite of benefits is really important to really demonstrate the importance of these types of interventions. So any questions to our panelists from the audience? Yes.
Thank you, Claire. First of all, thank you very much for those insightful insights from three big key donor organizations into the sector and also UN. My key question, of course, we as WASH sector, we don't want to be seen as contractor fixing the health sector problem. We want health sector realizing the importance of WASH into their healthcare settings, so that mothers gives birth to a baby in a clinic with the right WASH environment, isn't it? So as we know from the WASH sector that, okay, health sector has the primary drivers to fix this problem, but we have a potential kind of watchdog responsibility to work with the health. I think some of the prospective research priority that I have seen is it still looks like we as a WASH people has to say this, we still need to make the investment case to the health, because we know that in every 2 seconds a mother gives a baby to birth to a baby in a clinic. There is no water, sanitation, hygiene, and it's the more potential threat is health because of sepsis, antimicrobial resistance, and so forth, isn't it? I'm just thinking because World Bank, UNICEF, and USAID, all of us thinks about system. I certainly think that this is a systemic failure within the health, not addressing WASH into their healthcare settings. Is there any prospective research that you think we do as actors so that we challenge the health sector system rather us fixing the problem from our end? Thank you.
I'll take a shot. Well, I just say I 100% agree with you. I think this is the major problem we face, is that the health sector does not lead on this issue, and they say, oh, it's the wash sector, go do those. And there's a myth that this is just about facilities. There's like, oh, this is about a missing toilet or a missing water connection, and that's why I need the wash sector to come do it. No, the health sector needs to build facilities with connections to water or toilets, just like they have a delivery room or whatever, right? So they need to take leadership on this issue. And part of the problem is that we keep calling this wash in healthcare. And up here are all wash people from our wash part of the organization. There's no health people sitting up here, right? So this is part of the problem as well. I think we need to face. I think the research we all spoke to about quantifying the non-health impacts, right? Because this is what ministries of health, we believe ministries of health care about: staff retention, visits, revenue, right? They care about the indicators they're already monitoring on healthcare acquired infections, things like that. So we need to show the evidence to demonstrate that. And then second, I think we need to show the implementation. How do you do it, right? And I think one of the challenges is the guidance we've collected so far, and some of the things we've done is very projectized. And I do think you're right on. We need to integrate that into health systems. So we need to figure out ways to integrate our assessments and our action planning with healthcare into their existing systems. So there's not going to be a wash monitoring system, and it's probably not even going to be part of the HMIS or anything like that. It's going to be part of their routine IPC systems or other monitoring systems. It's going to be part of their existing human resource plans and human resource building, capacity building, mentoring, coaching approaches. I think that's what we need to find and demonstrate those approaches.
If I can just take a quick shot at it too, because this is obviously a huge problem for us too, not only at a country level, but even internally at UNICEF and across organizations. But one shift that we're trying to make with the Global Task Force is one, we've shifted from Global Task Force on Wash and Healthcare Facility to the Global Task Force on Wash, Waste, and Electricity in healthcare facilities. We are actively inviting our health and energy colleagues into the fold. But we've just shifted to a sort of higher level initiative called the Global Strategic Network, which is now engaging the directors for WASH and health from some of the key organizations. So now, within UNICEF, our health and our WASH director, from WHO, our WASH and health director, we're asking the same of the other key agencies and donor and practitioner organizations to bring these leadership positions to the table so we can have strategic discussions that sort of elevate the issue and mainstream it. So that's one. At a practical level in UNICEF, we've just received one of our largest grants from the Republic of Korea to do WASH and healthcare facilities, healthcare facilities more broadly, and it's a joint health and WASH initiative. So we are looking internally at how can we work in a more streamlined way where WASH is not, a service delivery provider, but rather like right from systems down to service delivery, we can look at an integrated approach. And I think both our health teams and our WASH teams recognize that this is, strategic from both perspectives to work together, because we are being required from our donors to work in a more intersectoral way. Yeah, sorry.
Is there one other question? Yeah, go ahead.
Hi, just a brief background. So I used to be a very small player in the sector, so it feels surreal to speak to three of you this close, because I would often wonder what kind of thinking goes on and how do you even define all of these. So my question is from that. So how do you set up these high-level research priorities? Is it linked to your funding cycle? How long are these and how often do they change? And also keeping localization in mind, what does that mean for the local players? Like, for example, if I was only focusing on healthcare and now I also have to work with waste and electricity, that's, a sudden change for us as well. So any thoughts on this? Yeah, thanks.
I mean, I think for World Bank, we're more opportunistic about how we can address research questions. And I think they're very much driven by the challenges that we are facing in our in the quality of implementation of bank supported projects. I think, you know, having these kinds of evidence reviews, systematic reviews is really useful to highlight some of the areas that maybe are sort of you know, we're blind to those, but maybe there are opportunities through our support, the support that we provide to answer some of those questions. But I would say we, in the World Bank at least, we don't have like an overarching research agenda related to WASH and healthcare facilities, but it's more some key questions that we need response to, so that we can know that our investments are efficient and sustainable.
All right. I think we will now pivot to our group activity. We're going to spend maybe about the next 15 minutes. We're going to have 2 groups set up, one on each of these boards. And what we're going to ask you to do is help compile some more maybe taking what the panelists said and what you all bring to the table. What do you see as some of the key priority research questions in this space? I think to keep it more tightly focused, we'll focus in on a few things that emerge from the panelists. I think focusing on water supply and sanitation, as we also learned from the evidence map, there's not a lot of evidence around there. And then maybe systems level and management type questions, I think would be good to focus on. We will share the list of questions that were generated from previous iterations from WHO meetings and other sessions. If you'd like to look at those and maybe modify them or you know, riff and build on those. If you're online and you have questions, feel free to submit them in the chat and we will shuttle them over to the groups. So we have post-it notes, and what we'd like to do is this, it's sort of called a pile sorting exercise, where as you're creating questions, think about ranking them in terms of importance and achievability, kind of on a axis like these. You don't have to put them on these little posters I drew. You can use the whole board to kind of map them out. And then we'll kind of reconvene for a quick report out from each group and then wrap up. So if you want to sort yourself in either group, and please don't leave. We do want to hear from you. We'll go ahead and get started. Lucy and Darcy and I will help facilitate each of the groups. So, I think let's just do both groups do all those questions. You think it's good? Yeah, I think if you want to tackle all those questions, we have a smaller group today, so I think it's fine to kind of think through some of the higher level things. Thanks.
Finishing up. Here we're aligned. We're all thinking the same thing.
Yeah. Yeah, exactly. Right.
I'm sure he's fine. But I'm just trying to mention. But I think that's too fine. It looks like we're gonna go off.
Yeah. Exactly. At least for Washington.
So they're very much this something great. No one wants to do anything like, oh, wow, the ownership is implication. So that's where.
Yeah, yeah, it's not a great.
Um,
Yeah. Infrastructure.
So I do think that. There. And then some of the
Basically the same as it. Agree with that. Just working at private care. District 5. No. One minute report out.
No, it's you.
Where's the, I don't know, yeah, it's going on.
That's fine. Almost at time. I think just a quick report out for the recording.
You don't have. Do you want to try? A lot of projects. Every situation. I think we kind of. Softer stuff.
Yep.
We're gonna go through like situated.
So.
Yeah.
Laws.
Yeah.
Okay. I would say that's not. Being controversial, something people don't want to make about it, so.
All right.
Yeah.
All right. We're at time. Let's see if we can do a quick cross. We'll do a quick cross group sharing. I think Lucy's going to attempt to summarize for our group.
Can I stay over here? Okay, great. All right, great. Thank you, everyone. So our group covered a lot of ground. So I'm not sure that I can succinctly summarize, but overall, we talked a lot about management and ownership for healthcare facilities, for Washington healthcare facilities, trying to determine who is currently owning Washington healthcare facilities, who should own it, and how we can collaborate across sectors, and also within WASH. So within, the letters of the WASH acronym, water, sanitation, hygiene, how can we better collaborate in those areas too? We talked about that in the context of sanitation, where sanitation in healthcare facilities is not just like the physical toilet, but also somebody has to clean it, manage it. There's wastewater to deal with. So thinking about how we can align, for example, cleaning and sanitation and try to delineate roles and responsibilities there. As well as communicate more effectively with the health sector. How can we put our research in language that is relevant to the health sector as well as understand sector priorities? And we touched a bit on with that kind of understanding health and non-health impacts. So quantifying things that are relevant to health like AMR and healthcare associated infection, and then also looking more broadly at issues around gender equity and unpaid labor in healthcare facilities. Great. I'll leave it there, but lots more that we covered. Thank you.
Yeah, I'll be brief because we had a number of the same points. thinking about what are the incentives for WASH, who's engaged, what are the roles and responsibilities, what are the accountability mechanisms in place, who's the lead. We thought those were all very achievable, so good things there. Some things that were kind of equivalently important, but perhaps a bit more challenging to answer, thinking about what strategies are there to incentivize and capacitate local government. And then we talked a little bit about the need for subnational coverage estimates and potentially thinking about different service level indicators for different facility types, and then cost estimates for those different service levels and service provision. Equally important, but perhaps a bit more difficult to answer than some of the other questions around roles and responsibilities.
Awesome. Thanks everyone for joining today. We look forward to reporting out these findings probably at a future Washington Healthcare Facilities community practice webinar. And yeah, excited to engage you all in this discussion moving forward. So thanks to our panelists and Lucy for speaking. And yep, thanks for coming.
Yeah. I agree. Anyway.